Dr. Aaron Spitz here, America's favorite penis doctor. And in this political season, where much attention is being placed on the sexual behavior or misbehavior of candidates or candidate spouses, it seems our country is suffering from a dysfunction, an electile dysfunction. And so I am inspired to discuss with you erectile dysfunction, but with a twist. Whether you lean to the left or lean to the right, and I don't mean politically, this discussion is for you. What I'm talking about is Peyronie's disease. Peyronie's disease is a bend in the erection. Now, I'm not talking about a subtle curve. I mean a really obvious angle, twist, indentation, or shortening caused by a hard lump of scar tissue that for most men occurs without any known injury. For a few men, it's an inherited condition. It goes along with some scarring in the tendons of the palm or the feet. And for a few, it is the result of an obvious injury, but for the majority of men, it's just bad luck. So here's what happens with Peyronie's. The penis is made up of two chambers. They're like long balloons. And instead of filling with air, they actually fill up with blood. And as they expand, they lengthen and harden. And the lining of these chambers in the human penis is made up of elastin, which is elastic and stretchy, and collagen, which is firm and strong. And so it gives it a property of being not only able to expand, but also to be very tough. It can take a beating, so to speak. Now, in Peyronie's disease, the collagen part of the lining overgrows. And so you get too much of the tough part, but not enough of the stretchy part. And in that part where the Peyronie's plaque, we call it, is taking root, that part of the lining won't stretch with the rest. So it stays tight and it's like a kink. And as the penis expands, it causes it to bend and narrow and shorten. So to add insult to injury, in this spot, in some men, the ability to trap the blood in the cylinder gets compromised, and so it's even harder to maintain the erection. Not only is it bent, but it may not be fully erect. So this is a very common condition. It affects about 1 in 10 men. The typical age is about 40 to 60, but it can happen in men even in their 20s or 30s. Fortunately, there are treatments. In fact, in a small percentage of cases, it goes away all by itself within the first year or two. But in the majority of cases, it stays or maybe even progresses. So there's really 3 main categories of treatment. One is stretching out that plaque. And that's done with a traction device. It sounds medieval, it kind of looks medieval, but it really works. However, it has to be worn for a few hours a day over a 6-month period. Another form of treatment is injection into the area that's too firm to break it down. And that's done over a series of treatments to gradually break it down so you don't injure the penis. And then a third form of treatment, the most definitive, is surgery to release or remove that area of scar tissue. Now, none of these treatments are very much fun, but in the end, it's worth going the extra mile, inch. Anyway, if you have Peyronie's disease, get it checked out. Perhaps I can help. At any rate, do yourself a favor. There are treatments and there is a solution. I hope this has been helpful. Don't forget to continue to follow me on Facebook, LinkedIn, and Twitter.